All right, so there is a new study, and it's found a number of emergency room visits linked to marijuana edibles, and they say it has tripled within a few years. More people are ingesting THC and not realizing the dangers associated with edible pot, which actually can stay in your body for up to 12 hours. Joining us right now is Dr. Harris Stratyner. He is an addiction and recovery psychologist, I think associated with Karen Rehab Facility, and Hillary Peckham, co-founder of ETAM. Okay, New York State's women's only women's run family medical marijuana business, right?
Yes.
Nice to have you here. So basically, the New York Times did a story on this yesterday, and they said with edibles, you just can't figure out the dosage. And so they're seeing more and more people, like in Colorado, that it's legal there, going to the hospital, and it's serious. Dr. Stratyner, what have you seen in your practice?
A lot of people who have not had psychiatric illness suddenly have a psychiatric incident because they overdose on edibles. It's hard to get an effect from an edible right away. So particularly youngsters get frustrated with how long they haven't got a high. They take more, and then they overdose and they have a medical crisis. We're seeing a lot more medical crises with edibles, and also we're seeing cardiovascular events with edibles.
What is cardiovascular events?
Heart.
Oh, heart.
Yeah.
Wow. Yeah. All right, Hillary, what do you say? Because you have a medical marijuana business, and one is right here in New York?
Yes, at 39th and Lexington. So actually, in New York, they don't allow smoking. They only allow vaporizing and ingestibles. So the core of our business is actually edible products. And we see significant benefit from it if dosed responsibly, and there's enough education surrounding it. So we have pharmacists at each of our stores to make sure that the consumption is safe, to make sure that you get the benefits from edibles.
All right, so what did you bring here?
So I brought a few different products that you might see in the medical market in New York. We produce capsules, we produce a tincture, which it's a oral solution. It's sort of like an oil that then you use a dropper and it goes under your tongue. And where I find edibles can actually have a benefit is with sustained relief, potentially overnight, or with patients who can't use a vaporizer, like elderly palliative care patients, end-of-life care, or potentially pediatric patients where they shouldn't be smoking.
Now, people can't just walk into your dispensary, right?
No, they cannot. You have to go to a doctor that's certified to prescribe this, and you have to get a card and enroll in the program.
So, Doc, I think where they're seeing this problem is in states that have legalized recreational marijuana, and you can just kind of walk in there with your driver's license.
That's what I'm talking about, not medical.
Yes. Okay. So, what can be done?
So we can do a better job in places like Colorado, et cetera, or New York, where kids get a hold of it, in trying to do what Hillary said in the dosing. And I'm familiar with Hillary's dispensary, and they do great work. But again, we're not talking about medical as much as kids who are abusing marijuana. Marijuana, whether you smoke it or you take an edible product or you use a tincture under the tongue, can affect your neocortex and cause you to have difficulty with short-term memory conversion to long-term. Has to do with your frontal lobe, up to the age of 30. And we're seeing numbers above 90% of admissions of adolescents at Karen treatment centers in Pennsylvania and in Florida, where kids are coming in and their primary diagnosis, marijuana.
So, you know, it's interesting. I mean, maybe their parents used to smoke marijuana, but this is not your parents' marijuana anymore, right? I mean, it's more potent?
Yes, much more potent. And again, the edibles, you're taking much more than you are when you're smoking. And smoking is going directly in your lungs, so you get an immediate high. Edibles, you don't. It's going through your stomach and your gut. It takes longer to absorb, so they get frustrated, they take more, and the next thing you know, they're in an ER.
So this is where I think the New York program is actually very successful, in that create pharmaceutical standards for the production and labeling and testing standards so that you know that each dose is consistent and each batch is consistent. So when we actually dispense this, first of all, there's a pharmacist that's overseeing the whole thing, but you can also rely that each dose is the same and it has a milligram content in it. So I think that as long as there's safe and educated consumption, this can actually be a huge benefit for people, where smoking, you're actually inhaling tar and some of the microbial and mold components of an organic plant material, and this won't have that.
And you don't see any room for abuse, even with the directions given here?
I think that in any sort of drug context, there's always room for abuse. But I think that New York's really taken steps to mitigate that. It's controlled through the iStop opioid tracking program, having pharmacists, third-party testing. These are all best practices to make sure that this is used in a safe and responsible way. And I think that in any program that's established, you should have that kind of regulatory infrastructure to make sure that you mitigate the risks that the doctor's talking about.
And we're almost talking apples and oranges, because they're talking about medical marijuana. I'm not here to put down medical marijuana. There are people who need it. I'm talking about recreational marijuana. And there are a lot of dangers even in smoking. In smoking, you can have cyclical vomiting syndrome, where you get very dehydrated and you vomit for 10 hours. And you can't stop it. People can die from that.
Is that common?
In people who are regular smokers, not in people who use once in a while.
In the 20,000 patients that we've seen out of our dispensaries, we've almost never seen it. So I don't think that with responsible consumption, it's something to be a huge concern. But with any drug, like alcohol or opioids or anything, you have to know the risks. And so education is a core component of what needs to happen.
So, you know, we keep hearing, you know, that New Jersey, New York, they're thinking about legalizing recreational marijuana. You run treatment centers.
Right.
Right. And I'm just wondering, like, what kind of signal does that give people who are...
A horrible signal, and I think that's the one risk with medical marijuana. Kids, I'm not talking about adults who have cancer, palliative care, etc. Kids hear that grandma's on CBD oil, and they go, oh, marijuana's a joke, let me smoke it. And it does cause problems, and marijuana is theoretically an emetic. It prevents you from throwing up, but with cyclical hyperemetic syndrome, it was important enough to mention in the New York Times with smoking. But again, if you've got a responsible pharmacist and dispensary for medical marijuana, that's not what I'm talking about.
Hillary, tell me about your family and your family-owned business. It's all female?
Yep, so we're the only women-owned, family-owned company in New York State, and we really got involved in this because, for one instance, I lost the use of my right leg for 2 years, and I saw how pain management could really be misdiagnosed and mistreated, and I thought that this was a wonderful alternative that really, you know, we see huge benefits. 12-year-olds who seizures stop in front of your eyes, or, you know, just quality of life and dignity given to somebody at the end of their life. And so we make an effort to make sure we have high-quality products and that we are responsible and educate all of our patients.
Wow, nice to meet you. All right, Hillary Peckham, obviously we can't go visit her. You need a doctor's order to go do that.
But you're welcome to call us. You can go to etanehealth.com, and we're happy to help you get enrolled in the program and go through that process.
And Dr. Stratyner, if somebody needs help, how can they find you?
244 East 58th Street, and I'm in private practice and also the regional clinical vice president of Karen Treatment Centers, the oldest and largest treatment centers in the United States.
All right, well, everybody's discussing this because, you know, as the city and state think that they can make a lot of money by people buying marijuana, you know, you also have to know the pros and cons of it as well.
Absolutely.
Thank you so much.